Good afternoon. I'm Gina Sweat. I am the Fire Chief for the City of Memphis, and I'm here today to get started with our City of Memphis Shelby County Joint Task Force press conference regarding the COVID epidemic. Start off with just a little bit of the numbers. Our vaccine numbers, at least a little over 500,000 Shelby Countyans have received at least one dose of the vaccine. We have 421,988 people who are fully vaccinated in our county, so we really appreciate and thank all of those people and encourage anyone who has not been fully vaccinated to please go out and finish your shot regimen. And if you haven't received your first dose yet, please do so. An update on the door-to-door campaign. We launched the campaign in May, knocking on doors in the Shelby County community. So far, the team has knocked on over 28,000 doors. So far this week, a little over 1,000 doors they've knocked on. And we've been using the data to kind of focus the areas that we canvass. So far, we've been focusing on the zip codes 38106, 38126, 38109, 38114, 38115, 38141, 38112, 38127, 38116, and 38107. Each of those zip codes have been canvassed at least 2, and some of them have been canvassed 3 times. So as the virus travels throughout our community, we will continue to use the data to show us where we need to focus our door knocking efforts. Also, our partnership with the University of Memphis, with the phone bank, making calls to our citizens. So far, they've made a little over 103,000 calls and reaching right at 55,000 people. So all of those calls are going out to try to encourage people to continue to reach out and get the vaccine. A special shout out to the Memphis Fire Department Healthcare Navigators team, a team that I am very proud of. That team has been working to vaccinate people in our most vulnerable populations, including the homebound, people experiencing homeless, and other people who may not have access to get out and get a vaccine at one of the local sites. So I really appreciate them. If you are homebound and need to schedule an appointment to get a shot, you can do that by calling 222-SHOT. That's 222-SHOT. Or you can go to the COVID-19.memphistn.gov website, and you can also register there, and they will be in touch and will come out and take care of that for you. Just a reminder, you can get first, second, or third dose of Pfizer at our Pipkin location, the Southwest Tennessee Community College location in Whitehaven, the Shelby County Health Department Immunization Clinic on Jefferson, and Germantown Baptist Church. For hours of operation, please visit our website, once again, covid19.memphistn.gov. And if you need a ride to any of those locations, you can call Ride Choice, 901 Ride Choice, at 743-3901. Then again, if you need a ride to one of those vaccine locations, you can call 743-3901. I just want to once again say thank you. I know that our numbers are looking better than they have in the past, but we're still not all the way through this pandemic. So I encourage everyone to continue what we're doing. Those who have not gotten vaccinated, please consider doing so. Continue to wear your mask and practice safe distancing and other skills, other things that keep us safe from the virus. At this time, I'll bring up Dr. Taylor from the Shelby County Health Department for a little bit deeper dive into the data.
Thanks, Chief Sweat. Have some slides to show to you today to go over the COVID landscape in Shelby County. First slide, please. Total COVID-19 cases reported today, 143,271. New cases reported today, 122. That is down from 294 this time last week and 350 2 weeks ago. The 7-day average of cases per day is 143. The 7-day average has also continued a downward trend, down from 237 this time last week and 302 2 weeks ago. We continue to see a downward trend in active cases in every age group. We continue to watch pediatric cases closely. Today, we report 553 active pediatric cases, down from 823 last week and 1,140 2 weeks ago. Pediatric cases now comprise 28.9% of all active cases, down from 29.9% this time last week and 31.4% 2 weeks ago. Next slide. The seven-day average test positivity rate is now 5.8%, down from 6.9% this time last week and 8.5% 2 weeks ago. Next slide. The effective reproductive number, or RT, of the virus is now 0.75. It has continued a downward trend that began in September and coincided with the mask mandate in indoor public spaces. Next slide. The hospitalization data also shows the same downward trend we have seen in active cases, and that's excellent news. Today, 317 COVID-19 positive persons are in the regional hospitals. That is down from 317 this time last week and 370 2 weeks ago, and active cases continue to decline in all age ranges, as you can see. Next slide. This is the map that I've shown before of active COVID cases in the county by zip code. Please note that the darker areas mean that there are more active cases in those zip codes. Next slide. And this is a similar map showing the pediatric active cases across the county, with the darker colors representing those zip codes that have more active pediatric cases. Next slide. And this is a new slide today. It illustrates what percentage of vaccinations given each day are first, second, and third doses. You see a spike in third doses in late September, early October, then a leveling off. We would like to see an increase in the rate of first doses, and we know that we have a lot more work to do. Next slide. Regarding vaccinations, currently 52.9% of the eligible population age 12 and up has received at least one dose of vaccine, and overall, on the total population, 44.6% have been fully vaccinated, meaning that they have received either 2 Pfizer vaccines, 2 Moderna vaccines, or 1 J&J vaccine. That's the end of the slides. COVID-19 vaccines are widely available in our community, as Chief Sweat shared. The Southwest Tennessee Community College Whitehaven site is open tomorrow from 9 a.m. to 6 p.m. and 9 a.m. to 1 p.m. on Saturday, and will be open every Friday and Saturday through November 20th. That site is serving hundreds of people per day with first, second, and third Pfizer doses. But I remind you that you can also receive your vaccine Monday through Friday, 8 to 4:30 at the Shelby County Health Department's 814 Jefferson location in our immunization clinic. And we hope that many of you who have not been vaccinated yet or have not completed your series or are desiring a booster will take advantage of that site. And with that, I will start the answering of questions.
Laura Testino, Commercial Appeal.
Hey guys, wanted to talk a little bit about vaccines today. In the summer, Memphis teens led the way in the state for age group and region in vaccine growth. As we've talked about today, pediatric cases and other cases are improving, but still it's those younger age groups under 30 that are trailing as far as, vaccination rate per age group population here. Are you guys concerned at all about this vaccination rate heading into the winter, especially as vaccines are about to possibly come online for 5 to 11-year-olds? And I'll have a follow-up.
Great question. So we remain concerned about the vaccination rates across age groups. As you pointed out, the pediatric vaccination rate continues to lag. We are happy that the active cases are going down, but we are continuing to encourage that population 12 to 17 to continue to get vaccinated. What I will tell you is that at the Shelby County Health Department, we are preparing for the possibility of the vaccine to be approved for that age group 5 to 11 years old with our partners. And we know that that's going to help, once that's approved, that's going to help drive up our vaccination rates. So we continue to watch that closely. We are encouraging parents to get information from a trusted source and then take advantage of the vaccine if their children are eligible for it.
Awesome. And then my follow-up is still to do with that 5 to 11-year-old vaccination approval. If I'm remembering correctly from May, once the EUA was given and CDC advisory approved with recommendations, Shelby County was pretty much able to go the very next day after that CDC recommendation approval to start distributing those. I'm not as familiar with whether the composition of the 5 to 11 vaccine is different, or if the dosage for that will be much different. Do you expect a lot of lag time between that CDC recommendation approval and when those vaccinations will be available for 5 to 11-year-olds here in Shelby County?
Well, what I can tell you is that on all of the state calls that we've had with the Tennessee Department of Health, we are already gearing up for that possibility. We know that the FDA will be meeting, I believe, on October 26th to discuss the EUA for children 5 to 11 for the Pfizer vaccine. And what normally happens is that the CDC's Advisory Committee on Immunization Practices will meet right after that to make recommendations. And so what we'll have to do is wait until that date to see what the FDA decides and then to see what recommendations the CDC puts out. But I will tell you that the state and us at Shelby County Health Department are already gearing up to be prepared to roll out that vaccine to that age group as soon as it becomes available.
Kelly Roberts, WMC.
Hey there. I wanted to talk a little bit about these pandemic indicators that continue to fall, which I know is great. With the vaccination rates that we're seeing right now, is there a combination with these decreased indicators of those with immunity from that surge that we did see with the Delta variant? How much do you think that plays into this, and does that give any cause for concern that maybe that immunity would wane and things could get worse, and the fact that people need to get vaccinated even if they have this immunity? Have you guys talked about that aspect? Thanks.
We have. Great question, Kelly. So we know that because we have more people who have been infected in the community, combined with those who have taken advantage of vaccinations, we know that we have less of a vulnerable population overall in Shelby County right now. With that said, we are still cautiously optimistic about the numbers coming down, and I say cautiously because we know that natural immunity tends to wane a lot more quickly than vaccination immunity. And we also have to be on the lookout for any future variants that could challenge any vaccine that we're giving and, of course, challenge natural immunity. And so this cautious optimism has us definitely celebrating the decrease in numbers, but also still, because our vaccination rates are just at 44% for our total population, still reminding folks that all of the mitigation efforts that we've put in place, encouraging people to get vaccinated, encouraging and requiring that masks be worn in indoor public spaces and in our K through 12 schools, daycares, and pre-Ks, all of those things combined are very important to keep us from having an additional surge. Doesn't mean that it couldn't happen, but right now the picture is looking pretty good. But we also have to remember that we cannot take those efforts, those mitigation efforts off just yet, because we don't want to be tipped into another surge.
Thank you. And I apologize if this was touched on at the beginning of this briefing. I logged on just a couple minutes late, but I know that there have been some studies that it seems like the FDA is even going to review a little bit that show that those receiving a booster from the maker that they did not receive their original vaccination series from did see some positive effects. Are we seeing at our public vaccination sites that there are several people who had received Johnson & Johnson or Moderna coming, hoping to get the available booster, which I know is Pfizer? Do you feel, is this information that you guys are following to see if maybe that would be a possibility at some point? Thanks.
I will defer some of that question to Chief Sweat because I don't have that data, and I'm going to look and see if she has it either. She doesn't. What I will tell you is that we've been very intentional. We have, and City of Memphis and everybody on the Joint Task Force has been very intentional about saying what the recommendations are, about sharing with people what they can and cannot get. But what I will also tell you is that the good news is the FDA is actually meeting on boosters for Moderna today, I believe, and J&J tomorrow. So I believe that we will see some new recommendations here pretty quickly. But of course, you know that the mixing is something that they're really going to have to bat around and decide what those exact recommendations should be doing. As far as the picture in Shelby County, most people who are showing up at the vaccination site understand that for the boosters, if they've had a Pfizer vaccine and they are not immunocompromised, then boosters are approved for those in those eligible groups for Pfizer. And then they also know for the immunocompromised, the recommendation is that you receive the same third dose as you had for your original 2 doses. But if you are not sure what you got and you show up, then you can get that third dose, but this is only in the immunocompromised population.
Kelly, was there another question?
Yes, I have just one last question. I was looking at last year and kind of comparing it to this year, which obviously we've had vaccines this year, but still there seem to be similar spikes at coordinating times of the year. We saw that summer surge, and then things kind of in the October 2020 timeframe did kind of go down. And then we again obviously saw what was the peak at the time of cases after the holidays. Is this something you guys are keeping in mind? Are you concerned with the holidays coming up? Thanks.
So you hit the nail on the head. We are cautiously optimistic about the numbers coming down, but we too see the trends. And on a lot of our graphics that we submit, we show where different mitigation efforts were put in place. Now, we know with the holiday season approaching that families and friends will want to gather, and we're asking people, we're highly encouraging people to remember that we still have COVID with us, and it's going to be with us for a while. So that's why we are encouraging everybody who is eligible in Shelby County to be vaccinated. That's the first thing, very important. But the other thing that we know, to keep the transmission rates going down, we know that folks need to wear masks in indoor public spaces and in schools, because that's going to help drive that transmission rate down. And we're also encouraging people to wear masks when they know they cannot safely socially distance. All of those things combined should pull us through a holiday season safely, but, and that's a huge but, please remember, viruses act the same, and that's why you can compare last year to this year, even with the vaccine on board. There's always the possibility of variants, and that's why having these mitigation efforts in place are so important.
Those are all of our questions today. Are there any closing messages?
The biggest message that I can give, that Chief Sweat gave, and that the Shelby County Health Department and the Joint COVID Task Force can give is to please get vaccinated. This is the best time to do it. We have several mass vaccination sites that you can go to. Our immunization clinic at the Shelby County Health Department is open 8 to 4:30, Monday through Friday. And we know that if we get our vaccination rates up, we're going to have a much better holiday season. And then also, remember, wear your masks in indoor public spaces. Make sure that your children are wearing their masks in K through 12 schools, daycares, and pre-Ks, and make sure that you're protecting yourself everywhere else you go where you know you cannot safely socially distance, or you know you're going to be around people whose vaccination status and illness status you are not aware of. We can do this together, but we have to stay the course. Thank you.
Thanks, everyone. We'll see you back here next week.